A rising number of COVID patients hospitalized, most cases linked by a common thread. Health officials in Harlingen comparing the COVID rush to the one we saw last summer. Good evening. Thanks for joining us at 10. I'm Oscar Adame. Christine has the night off. And our coverage kicks off tonight with Channel 5's Trevier Gonzalez. He joins us live from Valley Baptist Medical Center in Harlingen. And Trevier, what else are health experts saying about the current hospital situation?
Oscar, the doctor who I spoke with today told me even though that they are not at capacity with COVID-19 patients within their ICUs, the reality they're seeing within the unvaccinated continues to be grim.
I don't know which ones will live and which ones will die. And there is going to be death, unfortunately.
It's a challenge that's beginning to look more and more like 2020. Cases in Cameron County and the Rio Grande Valley as a whole continuing to rise.
The problem is most of the public does not live in the hospital. They don't understand what's going on in the hospital.
ICU Director Dr. Jamil Mahdi paints a picture of exhausted hospital workers and unvaccinated patients beginning to fill available beds.
Do you think at this current point they're having that sort of moment where they're realizing, I could have prevented this?
Absolutely. Unfortunately, it had to come to this point for people to realize how serious this disease is.
We weren't able to get an inside look of what those COVID units look like, but Dr. Mahdi telling us about 4 recent patients, their ages ranging from 30s to early 40s. Those individuals gasping for air, eventually being put on ventilators.
They were all fearful for their lives. They all didn't want to die. And invariably, they were all unvaccinated. These are the kinds of patients that we're seeing.
There are some breakthrough COVID cases of the vaccinated. Dr. Mahdi estimates it's about 1 in 30 of their patients, but states even then, the severity of vaccinated patients is vastly lower than those who have not had their shots.
Our greatest weapon of all is vaccinations. If we were to apply all these adequately and consistently, we can win this war.
Trevier, you also got word of a treatment that's being offered for COVID patients here in the Valley.
That's correct, Oster. That is called the monoclonal antibody treatment. You might remember that was actually what was prescribed and offered to former President Donald Trump back when he was diagnosed with COVID-19. Now, back then it was addressed as an experimental drug cocktail. Now, Dr. Jamil tells me that some studies have gone so far to say that the percentage of hospitalizations has gone down by as much as 50% because of that. But something that is worth noting because of this is that this is only for early on patients who are diagnosed for COVID-19 and not people who are in the ICU. As for now, reporting in Harlingen, Trevier Gonzalez, Channel 5 News at 10.